What's up guys, Chris Irvin, the ketologist here, and in this video I'm going to talk to you guys about continuous blood glucose monitors. So continuous blood glucose monitors, or CGMs, are these really cool devices that allow us to track our blood sugar in real time. So before, where you had to prick your finger and you could only get a single reading of your blood sugar, now with a continuous blood glucose monitor, or CGM, you can track your blood sugar in real time by simply scanning a device in your arm. So I'm about to put in my Levels device, which uses the Freestyle Libre. So what Levels is a company who has created an app to go along with the Freestyle Libre CGM that allows you to just track your data and give you a ton of different data insight, which is really cool because it allows us to kind of track our responses to specific foods. It allows us to track our responses to exercise and then see the differences from day to day. So it's a really cool device. I really love using it. This is probably my third or fourth time using a CGM, and the reason why I use these is, one, I like to do a lot of self-experiments, so it's really cool opportunity for me to just gather a bunch of data that I can put into infographics and make blog posts and videos with to share with you guys. But also it's a really great opportunity for me to kind of get insight into my metabolic health. So a few of the things that I love testing using a CGM is I love testing my fasted blood sugar, which we know is a really important indicator of our metabolic health. So, in the morning when we wake up, we want to make sure that our blood sugar is in a range that is, conducive of good metabolic health. So if you're waking up and your blood sugar is constantly in the, 100, 110, 120, 130, this is a sign that you may require an intervention to kind of get that back down to where it needs to be so you can have better metabolic health. Now, one of the issues with testing fasted blood sugar is that we have a spike in our fasted blood sugar in the morning because of cortisol. So we have cortisol spike in the morning that happens as a result of our natural circadian rhythms. It's just a part of our natural wake-sleep cycle, and this causes an increase in our blood sugar. So if you're using a traditional finger prick method for measuring your blood sugar, you may test your blood sugar first thing in the morning when you wake up. You may see that it's high, and then you may think that you have elevated fasting blood sugar, when really if you were to test again, a couple hours after waking up, you would find that marker is actually a lot lower than what you think it is. And the difficulty with doing this with a traditional blood sugar measuring device is that you have to use another strip, right? So you have to put another strip in there. That costs money. It takes more time. You have to finger prick. If you're not a fan of finger pricking, you have to do that several times to get those results. With this device, you only have to scan it, right? So I can scan it now, I can scan it 2 minutes from now, I can scan every 30 seconds if I want to. So that's a really big advantage to these devices. Another thing that I really like testing with these devices is my response to certain foods. So it's really interesting to see how your body responds to different foods and how that changes throughout the day and throughout what you're doing. So, for instance, if I'm maybe doing some experiments with carbs, it's really nice for me to see how my body responds to those carbohydrates. Even more interesting is seeing how that change in response is when I say exercise before or after those carbohydrates. So it's a really good opportunity to get a ton of data and a ton of just insight into what's going on with your health. And what I really like to do is I like to test both individual food responses. So, say if I want to test a certain fruit or a certain starchy carbohydrate, or even a massive bolus of protein, and seeing what the blood sugar response to that is, I can do that. And then I can also test that in a mixed meal setting. So let's say if I was testing a sweet potato as an individual food, well, what happens when I have a sweet potato with, say, a steak? Does that change my blood sugar response? Most times you'll find that it does change your blood sugar response. So it's a really great opportunity to see both individual responses, but then again, what is it in the actual context of a full meal, which is a little bit more similar to what you would actually be doing. So with these devices, each one of these, they come with two 14-day packs. So you put one of these devices in your arm. I'm going to put in my arm here in a little bit to kind of show you what that looks like. And you put them in your arm, you leave them there for 14 days. So you get 2 of these in a pack, which gives you 28 days of data collecting. Now, for somebody who is diabetic, which was before really about the only time that you could get one of these, is if you were diabetic, you had to be prescribed a continuous blood glucose monitor. Now, because of companies like Levels, they're making it a little bit more accessible to people who don't have diabetes, who just are, maybe pre-diabetic, but haven't had the diagnosis yet and haven't been prescribed a CGM, or people who are just trying to take preventative measures and just want to have some insight into their metabolic health. Companies like Levels is now making these devices a little bit more available, and hopefully in the future even more widely available so that more people can use them. But the thing about, so, if you were a diabetic and you were using these, you may want to use them all the time, right? You probably want to have insight into that blood sugar data all the time, especially if you're somebody who's doing, insulin injections or using different blood sugar lowering medications. It'd be helpful to have that insight. Now, for people who are doing this more for preventative measures or just want to have some insight into their metabolic health, there's really no need to have to do this all of the time. So my approach to this is typically about once a quarter. And that's, probably a little bit more frequently than most people need to do it, just because I'm somebody who likes to develop a lot of content out of this. But once a quarter, I get one of these and I do a bunch of experiments. I test a bunch of different food. I gather as much data as I can. And then I kind of review all of that data to see where is my metabolic health at? How am I responding to foods and exercise and sleep and stress and all of those things? And then compare that to the past data collection periods that I've done where, see what's the difference? What have I been doing differently in the last 3 months since the last time that I collected data, and how has that affected my blood sugar data? So that's kind of the approach that I like to use. I think for people who aren't doing this to develop content, you may be able to do it even less frequently. You may be able to do this, twice a year or maybe even once a year. These are a little bit pricey. It's something that it is out of pocket right now. Insurance is not going to pay for it. So, for somebody who's trying to be a little bit more cost effective, it's probably, better to maybe do this once or twice a year as opposed to every quarter like I'm doing it. But, really it just depends on kind of where you're at. So I'm going to go ahead and put one of these devices in just to show you how easy they are. And now keep in mind, coming from my research background, I have done a lot of finger pricking, both on myself and on subjects. It's kind of a pain in the butt. It is, I'm not averse to the finger prick, but it's just a hassle. And for some people, it's just, you really don't enjoy doing it. So this is a great alternative because you snap one of these in your arm, and I'm going to show you how to do that. And which doesn't hurt at all, by the way. Probably hurts less than a finger prick. And then it's there for 2 weeks, and you don't have to worry about doing a finger prick again. You can just very easily scan the data. So they go on the back of your arm. So I'm just going to do a little wipe down with some with an alcohol pad to just kind of sterilize the area. Okay, and then here is the device. So the device comes in this little container here. You pull the lid back. So you have it sitting in there, and then this is the kind of device that you use to plug it into your arm. So you just twist this off, and then you do have to stick this into here to get the device into the little poker. I don't know the proper term for that, the little poker, but here it is, and you can see if I hold it close that there's a little needle in there that's going to be going into my arm. So I just hold it on the back of my arm. I kind of find a spot that I want to put it on. I'm just going to put it right there, and then you just press. You heard the snap, did not feel a thing on that, and then you see it's in my arm for me to scan. So then what you have to do when you first put this in, it's important, you have to do a quick little scan in your Freestyle Libre app this is applying a new sensor to kind of give it time to calibrate. So you open up the app, click next, you click scan a new sensor, you give it a little scan, and it's saying that my sensor will be ready in an hour. So in an hour, I'll be able to start collecting data with the blood sugar, which I'll be doing a ton of experiments coming up, so you guys will get to see this, and I'll do some videos kind of showing you how I test when I'm doing these experiments as well. So that's it. And then one, little piece of advice when you're using these, Level sends these really cool little like stickers that you can put over top of these. This is really important to do, especially if you're exercising or you have like a labor job that you're outside a lot, just doing a lot of like manual work, because it is easy to, not super easy, but you can rip these things out of your arms. So it is really nice to put one of these on the back to just kind of keep it in place. I've ripped them out of my arm before, which doesn't hurt to rip them out of your arm, but if you rip them out of your arm, you can't use them anymore. So then it's a defunct device, which obviously is no good. So there I have the little thing on the back of my arm. So now anytime I want to scan my blood sugar, I'll just, once it's ready and done calibrating, I'll just open up my Levels app, I'll scan it, it'll give me my results immediately. So this is just a really cool way to get immediate results, guys. Just get immediate data, something that you can use tangibly, right? Something you can use and say, okay, this food is giving me a big blood sugar response, I'm not gonna have it, or vice versa, this food is not giving me a big blood sugar response, I'm gonna have it. So the data that you can collect here is really invaluable. So if you guys enjoyed this video and you found it informative, please give it a share and be on the lookout for more blood sugar experiments coming up using my Levels CGM. Thanks, guys.